Swayam Prabha. Digital India. Educated India.
A very good afternoon, everyone, again. Um, I have to sit, though I don't prefer to sit and give lecture, but now I have to write something here. So we will go for sit-up lecture. Okay, so we have already talked about, the healthcare supply chain, but special cases on COVID era. Correct. And so we have also learned, the vaccine supply chain, right? And during COVID, I want to start with one very important thing that I really don't know if anyone has noticed or had noticed in 2019, in Indian newspapers around September 2019 or September 2019, there was a news in some 5th, 6th page of the newspapers that China has built 1,000 beds hospital within a month's time. Correct? Yeah. There was no mention about any COVID coronavirus that time, So that time, we were amazed and we were just thinking that, how quickly China can build, facilities overnight, facilities of 1,000 bed, So this is these incidents are the alarm, If you ask how we can be prepared for the next wave, these are the alerts and alarms. We should be prepared for that. Why this hurry, why this urgency was. Nobody noticed that till October, November, December, next year, January, February, March. Till March, nobody could It came to notice that it is around December, January, when the students started moving out of work. Okay. So this is one thing, and second thing, this before that, probably there was a myth, okay, if any disruption or anything happened at any part of it, so what? We are staying far away from that place, okay? So that is another thing in supply chain. Now we are living in a supply chain where, any disruption, any untoward event happened at, even if it is farthest place, so be prepared that we are going to be affected very soon, okay? So that is that is very important for the preparedness, because many questions were asked, okay? During the COVID time, we all were waiting for the vaccine to come out, okay? But vaccine came out also, right? But nobody thought about what would be the logistical issues one has to solve, okay? So there was a lot of homework went behind that, how eventually a vaccine, how an individual like you and me would be eventually vaccinated, right? From where we would be vaccinated, right? And which vaccine we would get, okay? Right? And at what time that vaccine has come to that facility, okay? So this tutorial, our main objective is to understand, the role of optimization, okay? So we have actually discussed for past 1.5 days the more or less strategic decisions, right, in supply chain. So today we will throw some light on the operational issues of supply chain, okay, which might need optimization. And given the background of participants, we will try to make it easy to understand some mathematical concepts. But the disclaimer here is that don't worry much about the maths, okay? Try to understand the concept, why we are using that, okay? So it doesn't matter. So we will be discussing need of optimization, and then we will see how we can come up with programming models in the domain of linear programming, mixed integer linear programming. I'll come to why it is integer, why it is mixed, okay? And we will see some case studies. Case study, like, one of the case study we have already shared with you today, okay? Again, I would reiterate that case study, don't worry about the mathematical part, but get the gist of, the problem, the complexity, okay? So, one more thing that, when I'm sure you are holding some positions in healthcare supply chains where, if you are not like, good at programming, you're not good at coding, and your role does not expect you to do code, right? But you can attend and you can learn this session, so that you be aware of, right, what are the challenges and issues in having like, the optimization models or, the models there, which are like, the really the what you can say, the foundations of like, delivering. Now we are focusing on delivery of vaccine, okay? And logistics, distribution, they are the glue. They are the glue of supply chain, okay? In fact, the whole world learned the word supply chain during COVID. Correct? So even like, it became like, a buzzword, and now, it's a kind of necessity during COVID. Everybody learned about supply chain when COVID. Okay? So we will be seeing like, some simple models, right? So how this distribution, logistics distribution, and when we say optimization, first of all, how this is different from other distribution like FMCG, how we get shampoos, biscuits, like, that distribution, how that distribution is different from, our healthcare distribution. So second is very important. We all know we need vaccine, because we want to prevent, this casualties and, the spread of pandemic. But, the interesting part is we need to have more efficient logistics and distribution, effective logistics because of to ensure timely supply, equitable, right? Equitable and safe delivery. It's not ended here. You see here, we need this very effective and efficient logistics and distribution system network, right? I'll start with like, from the down one here. What are the aims and objectives we would see, right? Equitable delivery, right? So it should be delivered in equitable manner to the population. And this, what is the unique nature? Temperature control. Okay. So when we are distributing, how we would ensure, this temperature control in efficient manner. Even if government is giving funds, the criteria, one of the criteria has to be to do it at minimum cost, right? By minimizing the resources, right? Priority age group, right? Just imagine like, you are sitting in a hospital or, I would say, okay, even if we will put this responsibility on government, that, you take care of priority, which age group should be vaccinated first. Just imagine like, how government will manage this thing. We're talking of operational issues. Let's assume government will give this charge to some agency. Okay. Now, how agency will ensure? How would we find? Can you suggest? How would you find, where is the particular age group sitting, How would you ensure that? We are now talking of real operation and execution challenges, isn't it? How would we get to know that, where that age group is, right? So let me put, even if like, we would say this is the responsibility of the individual. The individual should come to the hospital and tell, I'm this age, get me vaccinated first. Okay. But where that old person should go, which hospital. How would we allocate the number of vaccines to a particular hospital, given that, this many number of older patients would come there? How to plan that? What is your proposal? Suppose you have been given responsibility, manage the vaccines. This is a priority. Age group, profession, pre-medical condition. Profession is again manageable. We know within hospital, frontline workers, police, that is still, we can do that. But general population, census, when last census has happened in India? You see what the challenge is, that this is actually first to identify where a particular age group is sitting. This next challenge is how to deliver the vaccines, right? So we would be talking, all that, this here. It needs a lot of planning, network planning, allocation. So how we can solve this problem, we will come to that. First of all, here, we are trying to solve the problem with lot of objectives. Generally, when we talk about logistics and distribution problem, even at operational level, at optimization level, we always talk about maximize revenue, minimize cost, right? But when we talk about healthcare, it's not like that. In healthcare, we need to optimize all these indicators. These are our aims and objectives. Priority, okay. Then varying storage requirements, right? Or whether we want to supply to single site, whether we have to give single shot or multiple shots. So it was recommended to have 2 shots, correct? What was the recommended gap between 2 shots? 15 days? 2 months? 3 months?
3 months. Already.
Yeah. You sure 3 months? Right? But why somebody said 15 days?
He likes vaccine.
Any dynamics was there during that time? How they decided 15 days, 3 months? No, actually everyone is correct. The gap between 2 shots, what was the ideal gap between 2 shots? 45 days. We have one more number, right? What was there in US? What was there in Australia? What was there in China? Has anybody investigated? Less than week?
Did
Did you get vaccinated? How was the reaction? I got fever of 102 for 48 hours. Can a person get vaccinated within a week's time? I'm not exaggerating. I got fever 102 degree, after getting vaccine, first dose. Yeah, I'm not supposed to answer that.
vaccine?
Yeah. No, the thing is that why there is so much of debate and why it was dynamic, the gap between 2 vaccines. Again, it was the availability. Again, it was the priority. Okay. If vaccine is available first, and if the old age people have not been vaccinated within 3 months, right? Or if it is available, then get it vaccinated within 60 days. Okay. So even those decisions were based on certain criteria in this object. And definitely we are working in the environment of scarcity of drugs or vaccines, we can say. Okay. So the idea is, how this optimization related decision, operational decisions in logistics and distribution are different in healthcare as compared to other sectors is that we have to manage all these objectives. Okay. And the decisions remain same. What decisions we have to make, where to locate the facility, how to allocate, vaccines to different hospitals, different clinics, or how we should manage our inventory, when to order, okay, how much lot size to order, okay, how to distribute it. So once distributed, what should be the transportation and the routing, right? Which hospital would go first, then second, then third, like that. These decisions are not new. These decisions are there for any sector. This is day-to-day decision. But how to take these decisions, that is dependent on what we want to achieve. Okay? And we are surrounded by all these factors. Varying vaccine availability. Okay? There was not one manufacturer, there were many. So there were questions like, if we have got first shot of particular brand, should we go for the same brand? Ideally you should go for the same brand, right? But, all those questions were there. There's a varying vaccine availability. Healthcare infrastructure, how far one has to go to get vaccinated. Socioeconomic pressures, right? There were many issues. Many people, they were apprehensive about it. Many were not. The cost was also important, like, the price. Some clinics, it was free of cost. At some clinics, it was more than 1,000. That actually also impact, the decisions. Education level, right? And risk perceptions. That's what many people think, side effects and all. Keeping all that in mind, how one has to take operational decision, like, what are the key decision problem here? That's what. So the decisions remain same, but how to take this decision, that only. So we will quickly go through, like, so in typical operations, in optimization, we have classical problems to solve, like assignment problem. But when it comes to healthcare, how it look like? So how to assign residents to open vaccination station or personnel to facilities to minimize total cost or total distance. Okay, how we can assign, right? And this can be even in hospitals, like, if we want to assign which nurse would be assigned to which ward. Okay, so there can be such kind of problems. So we have assignment problems, right, in healthcare. Then we have facility location problems. Where to establish vaccine storage hubs or vaccination centers to optimize coverage and cost. Okay, so we will solve this problem, right, using model. Okay, so facility location problems can be many now, right? So where to locate the vaccination centers. Okay, so where should be the distribution hubs be located. Okay, again, keeping in mind whether cost is our objective or there is something else. So when it comes to facility location in manufacturing, so manufacturing facilities, when we locate, generally what we see that if one has to suppose, I want to set up a car assembly plant, right? So what I would consider, what would be the ideal place for, that's what I want to consider. I want to determine the right location. So how would I decide this is the right location? Proximity of ports, okay. Transport infrastructure, okay. Road infrastructure, okay. Labor charges, okay. So we will be seeing that all those and many more factors, okay. Energy requirements there, okay. the only thing is that when we have to make facility location decisions, our prime focus is to manufacture it in that facility, okay, and then transport it to anywhere in the country. But when we are talking about, they can have a distribution center anywhere, okay? But when we talk about pharmaceutical or healthcare, patient plays a very important role, right? We have to see the convenience of the patient, okay? So how far the patient is, how far the hospital is, how far is the facility where patient has to come all the way to get it vaccinated, okay? That makes the facility location problems and facility location decisions different, okay? And then vaccine allocation, how to distribute limited vaccine doses across multiple region or stations, again based on demand and priority, okay? So it is not all hospitals will get equal vaccines, right? Because number of reasons. What is the population density a particular hospital is serving, right? What is the size of hospital? What is the capacity of hospital? How many doctors, how many nurses can administer that? Isn't it? That has to be deciding factor to allocate the quantity, allocate the number of vaccines to them, right? Why it is so crucial? What if you will supply more to a hospital than they need? Other facility will be starving, right? The shelf life, these are the low shelf life products, okay? And even to store that, you have to spend on energy and this thing, holding cost. Very good. So all these are very important. There are storage costs involved in that. So this decision is very crucial, the trade-offs, okay? So this is, that's what, covered under the vaccine allocation problems. And the transportation problem, again, how much cost it incurs from one facility to another facility, right? And inventory management problem. Again, storing an inventory for long, thinking tomorrow patients would come, versus stocking less stock, which we have been discussing, and risking, the patient's care. And vehicle routing and scheduling problems, right? Scheduling is very common in healthcare, right? How to schedule doctors, how to schedule nurses, how to schedule shifts, how to schedule, which hospital will get vaccines first, all that is a scheduling problem, okay? So, given that, as I've told you, these are the aims, aims and objectives that can be different. So, in line with that, I'll just show you one example here. So, if healthcare facility location, so what should be? Generally, we would see any, work in the area of logistics optimization, you would find only profit and cost criteria, okay? But just to sensitize you here, let's see, there are 3 cities, okay? And they have to make a decision on where to locate a healthcare facility, health center location, okay? So, if we would stick to age-old objective functions of maximizing revenue, correct, or minimizing cost, right? So, how that decision will change, right? So, you will actually come back to me. What are your observations here, okay? Now, you see that if our first criteria is maximize utilization, okay? To work on different criteria, the first input required is what kind of population is staying in each city, okay? So, you see that, each region, each geographical location is very different, from their demographics, right? Now, this says city A is, you can see city A here. City A has the population of many mobile and frequent users, Okay. So it also says that mostly it is many youngsters are there. Okay. Looks to be very dense also. Right. City B is centrally located. And city C, you will find elderly. Most of the elderly, old population stays there. Yes. It's a distance. Okay, it's a distance. Metropolitan distance. XY coordinates. Okay. So now you see that if you have to locate a facility, right, it depends on what is my optimization criteria. Okay. So whatever I've said, now we are explaining with example based on the demographics. If I want to maximize the utilization, then where should I locate the facility? It's written C. So why C? This is a maximize utilization. What do you mean by utilization? Need, right? They would be the frequent users of hospital or healthcare facility. If my goal is to maximize utilization, my facility location decision should be that locate the facility in city C. Okay? And if I want to minimize distance per capita, then it would be B actually. Both sides, this thing. Yeah. If minimize distance per visit, then it would be A. Right? So these things like, how would you come to know that, where the elderly are located? For that, you need to know distance coordinate. So the idea is that, so for any healthcare facility, so now you don't see here what is the minimizing cost, maximizing profit or maximizing revenue. That is not the objective functions. Okay. So that makes our optimization problems, or operations research problem, linear programming, or other related decisions which we have just said, that make it different from our other sectors. Okay. So that is very important, right? So we will come to this, the typical linear programming problems a little later. First, let me, whatever I have said now, let's solve some optimization problem first intuitively. Okay. So because once this intuitive approach would be set in, you will find it easier to adjust. So similar problem if we have to locate the healthcare facility, right? There are many potential location. Suppose we have a network like that. We have nodes, okay? And we have to locate healthcare facilities which should serve all the nodes. Okay, suppose, this is some remote area, rural area, okay? And we want each community be served from the healthcare facility, okay? So we need to again set some objective, okay? So for example, there is a problem of having 9 communities which needs primary health care. Now, we need to decide how many clinics, how many healthcare facilities one should open at any node, right? Or at which location. The number of facilities and the location where it should open. Okay? So generally when you would have this kind of network, you can intuitively see where it should be located. Okay? So the nodes here, the circle numbers, they are the nodes. These are the potential locations where we can set up a healthcare facility, right? The lines you are seeing is called their arcs, right? These are representing the distance between the nodes. Okay? So if suppose distance is in miles given, the distance between nodes are given, the location of nodes are known with respect to each other. Okay. Now we have to decide where to locate the healthcare facility and how many healthcare facilities should be located so that all 9 communities be served. I'm not saying the cost be minimized. I'm not saying profit maximization. Okay. What is the problem here? We want to open up the healthcare facilities where we should locate, right? So now there will be one more interesting thing, for the benefit of community, right? I want to locate a facility in such a way that it is accessible to other communities within some distance. They should not have to travel a long distance. Correct? So how we are going to locate that, right? So now this problem is solved with something called set covering problem. Okay, so this is again an optimization problem. We will come to its mathematical formulation later, but let's solve it intuitively first. Okay, now what is that? I want to have minimum number of location, right? Because even resources are restricted. I cannot open facilities at all nodes. Minimize the number of facilities. At the same time, it should serve all the communities. Not only serve, but serve in maximum convenience, right? So what is the convenience? Every community will be at least 30 miles from at least one of the clinic, right? So the maximum distance every community has to walk to go to the clinic is 30 miles. Then it is easy accessible. Okay. Now how we can go about? Where should we locate the facility? We would be having similar objectives even for vaccine distribution, right? So which hospital should be appointed, which clinic should be appointed, designated, as a, where we should allocate, which clinic to allocate for the vaccine administration, right? There also we can have similar kind of criteria. Yeah. So first answer is 4 facilities, right? Any other? 3, right? 3 facilities, okay? 9 facilities, right? Any other answer? I hope everyone appreciate the need of such kind of study. Very important. We need to operationalize it. Okay, I'll give you the answer. In this network, we just need 2 facilities to cover all 9. Right? So that's where, see 2 facilities. We will see how to solve it. First, one should understand that, what is the role of optimization here, right? Our optimization would help us to solve this problem in more a structured and scientific manner, right? So that we can become more efficient. Means the minimum number of facilities at the same time serving the community. Okay. So this is the agenda of it's a very important and useful methods linear programming, non-linear programming. This optimization helps us in serving the community or whatever aim we have, objective we have, with utilizing minimum resources. Okay, so we will see that now how to do that. So again, intuitively, identify for each community the other community can be reached. Then step 2, set of communities from each site. This is also one of the intuitive method. Still, we have not gone into our optimization model. So identify location which represents a subset of the other potential location. Identify all such subsets. Select the site common to 2 or more number of subsets. Okay, done. Have you understood anything? No. We'll go step by step. What step 1 says? Identify for each community the other community can be reached from it within 30 miles. Keep in mind the network. Okay. Step 1 says identify for each community. We have 9 communities. The other community can be reached from it within 30-mile travel limits. So you are all with, you want to cross verify? Okay. So step 1 done. Step 2, set of communities from each site set in step 1 minus community that cannot be served as potential site. Now step 2, whatever we have said, we need to cross verify. Can all these facilities in the column 2, whether they are also potential facilities to be served as potential healthcare sites? Do you see anything missing? 6. So these are the constraints, correct? In reality, we will be having some facility which is not capable of serving. They might not be having sufficient resources to, here is the, so 2 to 7 what? 40 miles. No, we cannot consider. It has to be 30. So that's why it is called maximal service distance. Specified maximal service distance. Our maximal service distance is 30 miles. Okay. So we will be having this kind of constraints. So step 2 will check that. Okay. So this is not the potential sites that serve this node. Okay. Now what is step 3? Identify the locations which represent the subsets of other potential locations. So can we identify such subset? From this step, you can see that the second row with numbers is subset of first, 5th is subset of this one. Correct? Step 4, select the site common to 2 or more number of subsets. Because, we have already checked, what are the other facilities can be reached from this in column 2. Right? Now tell me which are those 2 facilities? 3-8. Okay? So 3-8. Can we go back? Can we cross verify? Now tell me, you need 3 facilities, 4 facilities. How many facilities you need to cover our maximal service distance? 3 and 8 will cover all? Yes or no? Correct? Right? So now you understand, right? So what we are trying to do. Is this a real problem? Yes. Okay. So now the challenging part is, in real life, we hardly get such simplified network. Okay. To solve such problems, more complex network, right? We need to have some kind of optimization models, or you will say we classify them as a different linear, non-linear programming problems. Okay. So we will come back. I'll show you the math model for this, and then we will do some simplified linear programming problems for facility location, assignment problem, right? And transportation. Okay? I would urge, don't get afraid from the maths part, but you see the power of such models. Correct? Within minutes, you can decide which facilities will take care of whole geography, well region. Okay, so can we break now? Yeah, we can break for tea. Please come back quickly within 10-15 minutes.